Are you struggling with certain vision tasks but unsure if it's time for cataract surgery? The VF14 self-assessment tool can help you understand how much your vision is affecting your daily life. In this video, I'll guide you through a simple step-by-step process to use the tool and interpret the results. Plus, I'll share its limitations and what to do next if your score suggests you might need surgery. Let's get started. Now, what is this VF14 tool? The VF14 or the Visual Function Questionnaire was developed over 2 decades ago to measure the impact of visual impairment, especially from cataracts, on daily activities. It's been widely used in research and clinical settings, and you can find it online. Based on this questionnaire, I have made this interactive Google spreadsheet that auto-calculates the total score based on your inputs so that it can be used for self-assessment. Before we begin, a quick note. This tool is not a substitute for professional medical advice. If you have any concerns about your vision, please consult an eye care specialist. So let's dive into the tool. When you click the Google Sheet link in the first comment, you'll see this read-only version of the spreadsheet. Download a copy of it on your system so that you can edit it and complete the questionnaire. This spreadsheet has 2 sheets. The first has instructions on how to use the tool. The second sheet is the questionnaire. In the first column, there are 14 questions about everyday tasks like reading small print, recognizing faces, or driving at night. Each question is paired with a drop-down menu in the second column. In the drop-down, you'll see 6 options: no difficulty, mild difficulty, moderate difficulty, severe difficulty, unable to do, and not applicable. Simply click on the drop-down next to each question and select the option that best describes your experience with your glasses on. If a task doesn't apply to you, select not applicable, and don't worry, these responses won't be factored in your average score. As you select your responses, you'll notice an average score is automatically calculated at the bottom. The average is then multiplied by 25, giving you a final VF14 score on a scale from 0 to 100. A higher score means better visual function. I have also added this table where you can find the degree of visual impairment based on your score, like no visual impairment, minimal, mild, moderate, severe, very severe. Also, I want to highlight an important point. This tool is a great way to assess your overall visual function, but it's not 100% perfect in every situation. For example, let's say you have no or minimal difficulty with most activities, but you have severe difficulty with night driving. Since the score is based on the average, your overall VF14 score might still be high, even though your night driving is a major issue for you. This is why the VF14 score should be used as a guide and not a final decision maker. Your specific symptoms and lifestyle needs matter, and that's why discussing your results with an eye doctor is always a good idea. If you are having any trouble with the Google Sheets version, I have also uploaded a PDF version of the VF14 tool. The PDF is fully printable, although it doesn't offer auto calculation features. You can find both the links in the first comment below. If you have no difficulty or only mild difficulty in a few activities, then cataracts are not significantly affecting your quality of life yet. In this case, even if you undergo cataract surgery, the improvement will be minimal. However, if you start noticing mild to moderate difficulty in multiple tasks, it's a sign that cataracts may be interfering with your daily life. Now that you have your VF14 score, don't miss this video on the golden window for cataract surgery, where I break down the ideal time for cataract surgery for the best results. Thanks for watching.